The opinions voiced in this material are for general information only and are not intended to provide specific advice or recommendations. To determine which investments may be appropriate for you, consult with your financial advisor. The Trump administration's latest tax proposal, also known as the Big Beautiful Bill, has been making headlines over the past few weeks. The bill includes extended tax cuts, proposes no taxes on tips or overtime, and adds more requirements for certain programs like Medicaid. The two biggest changes require able-bodied adults without children to work at least 80 hours per month, and it requires recipients to re-enroll every 6 months instead of once per year. Joining me today to address these Medicaid concerns is elder law attorney Pat Simasko of Simasko Law. So my first question for you is, what are the proposed Medicaid cuts and who do they impact here in Michigan?
Well, the trouble is, I don't know that we know what the actual Medicaid cuts are. It's a cut to the Medicaid budget, and they put some restrictions on it on, like, you have to work. If you're a younger person and healthier person, either work for charities or do some other type of work. So when the budget gets cut, then it's going to be up to the states to figure out, okay, now what do we do with less money? So that could be less money going to hospitals, less money going to nursing homes, less money going to, daycare centers, less money going to medical treatments and stuff like that. So you just have to see how each state is going to, play it out once they start getting the reduced funds.
Yeah. Have a lot of people been calling you worried about this?
Not too much. When people do call or do they talk, I go, listen, I'm not the person to call because you need to call your congressman. I implement and I protect assets based on whatever the law is. So you can't be guessing, and I can't be guessing and trying to figure out what to do on something that we don't have a clue on what it is.
Yeah.
So what I tell everybody is you need to protect your assets so you can get qualified for whatever Medicaid is going to be available in the future. Just like you need to get Medicare, and you need to collect your Social Security, and there's conversations and strategies to max out whatever benefit you can.
Earlier you were talking a little bit about like the work requirements. Can you kind of elaborate a little bit on those?
Yeah, I mean, there's certain things on to get qualified for Medicaid and to stay on Medicaid. They are saying, hey, just don't sit around on your iPhone looking at videos all day long. So if your age is between 19 and 64, they want you to work 80 hours per month, so 20 hours a week, essentially, at work, a job training, or volunteering in a charity to stay enrolled, which that's just one of the elements. And again, I'm not making a judgment on what that requirement is, good or bad, and you can have your own opinion. And that's what I tell people. Don't call me, call your congressman if you don't like what the law is.
I mean, there's millions of people that are on Medicaid. Why do you think the government is choosing to reform that budget specifically? I know it's not the only one that they're looking at,
it's a huge cost. I mean, if you look at, like, when we talk about Medicaid for our seniors and Medicare, it's two different benefits, but it's 10,000 people a day are turning 65, and that's not going to stop for a long, long, long time. It's the baby boomers, and then the baby boomers had kids that are growing up. So the cost of health care is going to be astronomical for our senior citizens because they're living longer. They're not necessarily living healthier, they're just living longer. So how to pay for that? They're not working. They're not contributing into the system. They're pulling the money out of the system. And there's not as many workers in the workforce. So it's how do you pay for health care? So that is a huge part of our budget. It needs to be addressed.
Yeah. Maybe here in Michigan, what do we stand to lose financially if these cuts do happen?
Medicaid is a state-run program that's funded through the federal government. Okay, so the federal dollars come in, and then Michigan spends those dollars on the Medicaid recipients. So the question is, when the state's getting a lot less money, well, really, where it's going to fall on, if you're a poor person and you get hurt, you're going to the emergency room, and they're going to take care of you. Now, if that person doesn't have Medicaid, that means the hospitals aren't going to get paid. And they can't do that forever. So they're going to really be restricting the type of care that they're going to be providing for these people. And then Medicaid will be paying a certain amount. But people, they're going to keep going to the emergency room. Emergency room is going to be their care provider versus going to a doctor and have the doctor handle it and getting paid through Medicaid. So the quality of medical treatment definitely is going to go down if the Medicaid budgets are reduced and not as many people are on the rolls.
With the money that they're trying to save through this reform, do you know what they're planning to do with that money?
Well, the way that I understand it is it's tax breaks for the wealthy and then the military. And military would include like the border protection.
Are these changes going to save money in the long run, do you think?
Well, is it going to save money? It's really, when you're looking at the whole, if you take $880 million out of the Medicaid budget to give it to another, government program or a tax reduction somewhere else, I don't know that it's saving the government any money. It's just reapportioning the money to a different entity or a different place, which then you have to look at some other political goal and why they're doing it. It's not like they took the money and paid down the deficit or have less of a budget. They're just spending it different way.
For those maybe who fear, maybe people my age or a little older who might feel like Medicare and Medicaid is going to be gone by the time they need it, what would you tell them to do now to prepare?
Well, that's a darn good question. That's a very legitimate question. It's the young kids are having to pay for the debts of the older generation. So all the baby boomers, they went through the work and now they're retired and they're into retirement, and they're the ones that are collecting Social Security and Medicare and Medicaid. But that budget is being paid by the people that are paying into it, which are the younger people. So the younger people are cashing the checks. And it's the same thing if you look at our pollution, and our oceans are polluted and our air is polluted and all that type of stuff. It's the kids that are going to have to put up with it. And I think the younger generation is seeing that this world is a kind of a screwed up place. They don't want to bring anyone else into it,
Yeah.
So they're having kids. So the birth rate is going down. So it's a weird time.
There's a lot of uncertainty going on. For people maybe who are worried about losing these benefits or might be approaching retirement, what advice would you have for them?
You have to plan for getting the benefits. People come in to see me as an elder law attorney. They're planning to avoid probate, which is protecting their assets from probate. Well, at the same time, protect your assets to get Medicaid. Protect it maybe to get Medicare in the future. Look at getting Social Security. The more money coming in is the less drawdown on your retirement. People don't have pensions anymore. So their income in retirement is Social Security and their retirement accounts. A third of us will be in a nursing home, and the average length is about 32 months. So that's about $300,000. How do you pay for that, right? And nobody wants to go in the nursing home.
Yeah.
They want stay home or a nice independent or assisted living. Perfect place. Well, you have to pay for that. So start looking at, some type of a long-term care benefit that you can look at. But the type that are long-term care, the traditional policy, if you don't use it, you lose it when you die. There's other policies that if you don't use it, it goes to your kids as a benefit. So you're not wasting that money. So it's there if you need it, but it goes to the kids if you don't use it, if you're one of the lucky ones.
Depending on how this shapes out, because I think it's still sitting in the Senate right now, how do you think this will impact other programs?
It's all going to be, you only have so many dollars. The U.S. government can print money, right?
Yeah.
They literally can just print more money. But Michigan can't print more money. So they're given a budget. In that budget, they create a budget, and that budget says, okay, from that budget, we're going to have, so many billions of dollars from Medicaid. How are we going to spend it if now we used to have, and I'm guessing at the numbers, if we had $3 billion and now we only have $2.5 billion, you got to cut someplace. So you just have to see now in the Michigan Medicaid in the legislature, how are they going to be spending those dollars? Right? Are they going to be cutting, food stamps, or are they going to be cutting prescription eyeglasses or dental, or probably reducing the payment to the hospitals and the doctors? Instead of $10, we're only going to give you $9. Okay, well, now the hospital's got to eat it.
There's only so much money to work with, and it's just challenging to
that's it.
kind of
There's only
balance it.
Yeah, you got to balance it, and that's what it is. And so every young person says, don't cut, health care for unwed mothers, cut the old people. And the old people say, don't cut us, cut the, health care benefits for the young person. Right? So it's that yin and the yang. Right? It goes this way or that way. And that's why politicians fight. And that's why people, instead of calling their friend to complain about it, call their congressman.
Yeah. People who are worried about this or feeling concerned, I know age comes into play too, and your personal timeline of when you want to retire, but what would you say to anybody who's fearful about this?
When you retire, right, you're going to retire from General Motors or the post office or a mechanic or wherever. It really doesn't matter. You're going into a new phase of your life. When you do that, go to a elder law attorney to talk about what legal documents you need and also how to best to protect your financial assets. And when you protect them for yourself, and you protect yourself first, and then whatever's left over goes to the kids. And then at the same time, for the younger generation, you have to start planning for your retirement. Don't go out and buy the fifth iPad and the new iPhone and the brand new car and the this, that, and the other thing, thinking that Uncle Sam is going to be there to cover all your expenses in retirement. You have to plan for your own retirement.
Yeah. You have to rely on yourself.
You have to rely on yourself.
All right. That does it for this edition of Not Your Father's 2 Cents. At the time of this recording, nothing has been passed yet, so be sure to stay tuned for that. And if you have any questions or concerns, reach out to your financial advisor. Thank you so much for listening, and I'll meet you back here next week.